So the commonest cause of tummy pain that requires surgery is appendicitis.
Appendicitis, right? Okay.
So appendicitis is a condition whereby appendix is a blind ending tube with the opening into the large bowel.
Right.
So a small piece of feces will get lodged in the bottom part of the appendix and therefore block the appendix.
Right.
The appendix is producing mucus constantly, so the mucus cannot escape, and there's also bacteria within it. The mucus is fantastic food for bacteria, and therefore there is pus formation within that cavity. And as more and more mucus is being produced and more bacteria is being produced, it gets distended bigger and bigger and bigger. And at some point where the wall of the appendix becomes very weak, it perforates or bursts open. So you've heard about burst appendix. Basically, this pus within the appendix just spills over into the tummy cavity, and it can make the child very sick. So before the child gets to that stage, we should identify this and treat it. And the symptoms that the child presents with, usually tummy pain locally in the belly button area or umbilical area, and then later on it more specific to the right side.
Right.
In younger children who are the preschool age, is harder to diagnose because they cannot localize the pain so well as in older children, where the pain is very specific in the belly button and then right side. In younger children is harder. And secondly, in younger children under 5 years of age, they perforate or burst earlier than the older children. Why this happened, we don't know. But in the younger children, they burst earlier, and also the symptoms may not be so easy to identify. So therefore, it is more of a clinical challenge for surgeons to identify and diagnose appendicitis in younger children. In older children, it's easier. It's almost identical to the way adults present. So the treatment for appendicitis, in my view, is purely surgical. Once we identify that this child has got appendicitis, we would offer surgery. Prior to that, we would give them some antibiotics to prevent the spread of the bacteria into the bloodstream. So once the child has had adequate intravenous antibiotics, then they'll proceed on to have surgery. The surgery that I perform is a keyhole or laparoscopic appendicectomy, whereby there are small cuts in the belly button and 2 other small cuts in the tummy, made to dissect the appendix out and deliver it through the belly button.
So the appendix is removed?
Yes, that's right.
Right, okay. And the appendix is a little bit of a redundant organ, right?
Yes, so if you're a rabbit, you require it to digest cellulose, which is the grass.
Right, but you don't treat rabbits, right?
No, we
so
don't.
People shouldn't be bringing rabbits to you anytime soon. Okay.
No, in human, the appendix is a rudimentary structure.
Right.
So it's shrunk, and there is some function. There is some research showing that there's some function in newborn babies, whereby there's a place where they mature the immune cells as a newborn, but after that there's no function at all in the human being.
And recovery is usually how long of an affair?
So the appendix is identified very early, where the appendix hasn't ruptured. The recovery is fairly quick. Within 2 days, the patient is moving and home. If the appendix is ruptured, then we will have to analyze the bacteria that's within the pus that we collect within the abdominal cavity, and we'll target specific those bacteria that's found with the right antibiotics, so that the bacteria within the tummy is completely eradicated. The problem with burst appendix is that they can go on to have collection of pus within the tummy. So we need to make sure that the appendix is the pus is completely cleared.
Right.
So one, by washing out the tummy cavity when we are doing the original appendicectomy operation. And secondly, by giving the right antibiotics. So I usually start off with a reasonably broad spectrum antibiotics intravenously, and 2 days later we should obtain the culture, which is the type of bacteria that's grown within the appendix, within the pus, and also the right antibiotics that's suitable for that patient to take. So I will also then convert that antibiotics to an orally taken antibiotics and send the patient home with that for another 5 to 7 days.
Right.
And that should hopefully clear out the bacteria that's within the tummy cavity to prevent collection of pus forming afterwards.
Right. And then a full recovery is.
That's right. Yeah. So
yeah.
the patient usually stays anything from 4 to 5 days with the perforated appendicitis, and then the full recovery is up to about 2 weeks, depending on how severe the appendicitis is.
Great. Thank you, Doc.